Hi, I'm Dr. Ramesh Dalwai, Orthopaedic Spine Surgeon at Sakra World Hospital. Today we are talking about a condition called scoliosis. So scoliosis is, in simple words, is an abnormal sideward curvature of the spine. Normally when we look from the front, the spine is usually straight, but in people with scoliosis, it tends to have an S shape. And by definition, the Scoliosis Research Society has given the definition that the curve needs to be at least 10 degrees or more to be called as scoliosis. So who does the scoliosis affect? Scoliosis can affect any age, but it is commonly seen in children. And it is also important that we identify these deformities in children, because as the children are growing, so as the children grow, the scoliosis deformity also tends to get bigger and bigger. And that basically starts with uneven shoulders, uneven hips, but as the scoliosis gets bigger, the spine not only turns on the side, it also twists on itself. Because of that, they tend to get a big rib hump. Why is it important? Because as the curve gets bigger in children, it can affect their growth of lungs and the lung capacity, which with time can have a negative effect on the heart as well, and they tend to have breathing difficulties and heart problems. So once these scoliosis is identified, what do the parents do? Sometimes it is identified by their school teachers or PT teachers, where children are wearing a little bit more tighter clothes. It's evident that the shoulder balance is off. One shoulder is slightly higher than the other, or the pelvis is higher than the other, and they tend to have this big rib hump at the back. Some people put it down to wearing school bags, but scoliosis, there is no evidence that is caused because of the school bags. However, it is important to carry a reasonable weighted school bag and wear the bags correctly. When the scoliosis is identified, please consult an orthopedic surgeon or a spine surgeon with experience in treating scoliosis. They'll be able to go through the clinical examination, examine the child to identify the nature of the curve. Sometimes these can also affect the spinal cord or the nerves inside the spine, and a thorough neurological examination is also done. Now, depending on the age of onset, the scoliosis is classified into various types. There is congenital type, there is neuromuscular type, where children tend to have problems with the nerves and muscles, and because of the imbalance in the muscles, it develops scoliosis. Then there is adolescent idiopathic type, which is usually the commonest one. And it is idiopathic because we still do not know what exactly the cause is, but young teenagers, they tend to have this scoliosis. It is definitely much more common in girls than in boys. And then, of course, sometimes the scoliosis is identified later stage because it was quite small curve in the beginning, but people tend to have x-rays for back pains. That's when scoliosis is identified. And certainly older population also can develop scoliosis because of the wear and tear. So once the scoliosis is identified, please consult an orthopedic surgeon or a spine surgeon with experience in treating these deformities. Thank you.